I'm Dr. Kevin Calder. I'm a plastic surgeon specializing in pediatric and craniofacial surgery here at Southern Illinois University School of Medicine. One of the interesting things about being a pediatric surgeon is that there's a lot of complexity, and so it's really a neat opportunity to be able to connect on a level with the children and then see how it all ties together in order to create some mutual understanding, create a plan for these children, help them to be at ease with the hospital experience and with the upcoming surgeries that will take place. I think education and relationships are the most important thing that I can offer parents and children because it's such a new experience for them. I have experience with all the different pediatric and craniofacial anomalies that we deal with on a day-to-day and week-to-week basis. But for parents and for children, this is a first-time encounter. It's a first-time experience. And so all of the information that I can give to them, showing them pictures of before and afters, also, it helps them to be able to be comfortable with the situation, helps them to be prepared, and it helps them to be able to be ready for their surgery and digest it in a way that's meaningful to them. One of my surgery mentors, where I was training in surgical residency, was a volunteer with Operation Smile and had been a volunteer for over 40 years. And one of the first times that I met him at the early stages of my training, I was sitting in his office waiting for him to come, and he had a book on his coffee table, and it was an Operation Smile book. And as I was sitting there waiting for him, I had a chance to go through the book and to read about patients' stories, see the difference it made in these children's lives, to see how it changed their parents, to give them a gift that their parents could not give them. And so even 2 to 3 years before I finished my training, I contacted Dr. McGee and told him, I absolutely want to come and spend a year with you, learn from your organization. And then that started the building of a great relationship. I've had an opportunity to go on over 13 missions. Under a year ago, I had the opportunity to go to the Philippines for my third time. Then I met a boy whose name was Alj, who is 10 years old. And he was ridiculed by his community. And despite that, his mother, I've never seen something so amazing as the power of a mother and a mother's love. And these children cling to their parents, but especially their mothers. And she's helped him through all of that. And despite not being able to get surgery earlier by the time he was 10, she was able to bring him to an Operation Smile mission. And so I sat with her on his bed and spoke to him about his story. And he told us how children in the community would call him a vampire monster and would tease him incessantly about something that he couldn't control. And to see, when I first met him, to see his eyes down and to see him withdrawn and not used to engaging, with somebody in a communication, it was quite striking to me. And through the course of the week, we were able to fix his cleft lip and to repair his nose. And by the end of the week, his whole countenance, his whole demeanor had completely changed, and he was able to smile. He was able to give us a high five and speak with us, and so that to me is just amazing to see that transformation that happens, and then to see the gratitude that comes from parents and from the mothers, because in a lot of ways what we're doing is, and not me as a surgeon, but I'm talking about us as an organization and donors included, what we're able to do is give something to somebody that they otherwise never would have the opportunity to have. And so that's a real blessing, I think, and the real magic of Operation Smile is being able to give that and be a part of that.